Um, um, Good evening, everyone. Good morning, or wherever you're joining from. Thank you so much for joining this session today. This session is in celebration of the International Women's Day 2026, and we're really excited that you're joining us from wherever you are joining us from. My name is Ola, and I'm from OT, and I really welcome you once again into this webinar. On International Women's Day, we believe it's really especially fitting that we turn our attention not only to celebrating women's contributions, but also on strengthening the systems that ensure women are visible, counted, and included in decision making. We are really excited and fortunate to be joined by an exceptional panel of experts who would offer deep insights into why collecting and using disaggregated data matters and what it takes to make that data genuinely meaningful in practice. The Sendai framework for disaster risk reduction makes clear that effective disaster risk management must be grounded in disaggregated data, including by sex, by age, and by disability. It recognizes that women's participation is not peripheral, but central to managing disaster risk effectively. But yes, what we think is also critical. When disaster strikes, it is too late to build those foundations then. Early this year in January 2026, Mozambique was flooded. 800,000 people were affected. Women and children were the majority. An emergency response system didn't have the data to see their needs. Without this adequate gender disaggregated data, we cannot know who is being left behind. We cannot ensure that women are included not only as beneficiaries, but as leaders, advocates, and decision makers in disaster risk reduction and humanitarian response. Data provides knowledge, and knowledge saves lives. It reduces impact and strengthens long-term resilience. It also allows us to learn from today's crisis so we can build better systems for tomorrow. In short, we believe that collecting and using gender disaggregated data is not optional if we are serious about the promise of leaving no one behind. I really look forward to hearing our speakers explore how we can strengthen the evidence base and data systems to ensure that necessary data is embedded in disaster resilience from the very start. And I encourage everyone on this call to make use of this session and ask questions relevant to your area. If you are just joining us, once again, welcome and thank you so much for joining the International Women's Day webinar that will be focusing on gender disaggregated data. We would like to sort of get to know you, so you can drop in the chat where you're joining from. Tell us where you work. What are you feeling like today? Are you excited to be here? We would really like to meet you, so you can just drop that in the chat. So we'd like to meet you so you can tell us where you're joining from. I'm sure we have a lot of different individuals here. We have mappers, government officials, funders, humanitarian workers across different time zones. We are a global community tackling one problem. Thank you everyone for dropping that in the chat. Really excited that we have, a global pool of community in this call. Before I go into introducing the panelists, I would like to welcome Liz. Liz is the Deputy Executive Director at HOT. Hi, Liz. Thank you so much for joining the session today.
Thank you, Ola. And I just wanted to say welcome to everyone. What an honor it is to have the panelists here today. I know we're really excited about the work that we'll be talking about, or the work that's been going on, and really excited about this conversation. So thrilled to have everyone here. I hope you enjoy the presentation and the discussion. And yeah, I'll turn it back over to Ola, but welcome to all. Welcome to our panelists.
Thank you so much, Liz. So once again, I'd just like to say thank you so much for our panelists as well for joining the session. We really look forward to all of the insights that you will be bringing to this very important discussion for today. So I think it's time for us to get to meet our panelists. So I'm going to pass the mic to Veronica. Veronica, you can just tell us who you are, your name, your role, where you work, and one thing about your work So over to you, Veronica.
Thank you, Ola. Hi, everyone. My name is Veronica Shiku, and I'm the technical coordinator for the Humanitarian OpenStreetMap here in Mozambique. I coordinate hot disaster resilience mapping work in the country, working closely with INGD partners and local mapping communities to strengthen the use of open geospatial data for disaster preparedness and response. Thank you.
Thank
Over
you
to you,
so
Ola.
much. Thank you so much, Veronica, for joining the call. I'm going to pass it over to Director Christina as well to just introduce herself. So we'd like to know who you are, what you do, and one thing about the January 2026 response. Over to you, Director Christina.
Olá, boa tarde mais uma vez. Eu chamo-me Ana Cristina, sou diretora do Centro Nacional Operativo de Emergência. O Centro Nacional Operativo de Emergência é o órgão do Instituto Nacional de Gestão de Risco de Desastre, que coordena todo o processo de resposta à emergência, não quando o país está numa situação de emergência, mas numa situação de calmia, é o órgão que tem a responsabilidade de garantir o mapeamento e a monitoria contínua dos fenômenos, mapeamento das zonas de risco, as bases de dados, e todo este processo que permite uma melhor preparação e resposta em caso de emergência. Obrigada. Bem, se calhar, em termos do que aconteceu, em fevereiro deste ano, tivemos situações de cheias severas em 4 bacias do país. Falo da bacia do Buzi, Limpopo, Engomate e Umbeluze. Destas cheias resultaram em cerca de 720 mil pessoas afetadas. E logo a seguir, em março, tivemos também um ciclone. Felizmente, o ciclone não chegou o olho não chegou a entrar pelo continente, mas esteve a 100 quilômetros da nossa costa. Nos ressentimos dos seus efeitos, felizmente não de forma intensa, e também teve cerca de 9 mil pessoas afetadas, 9 mil famílias afetadas. Muito obrigada.
Wow, thank you so much, Director Christina, for really sharing that, and thank you so much once again. I'm also going now to pass it over to Pilar as well to introduce herself. You can tell us who you are, what Gates Foundation does in terms of emergency preparedness and response funding, and why gender data matters to you.
Thank you. Thank you, everyone, for this invitation. It's a pleasure to be here and to share a small part of what the Gates Foundation does. My name is Pilar Pacheco. I'm based in Seattle, in the state of Washington, in the United States. This is where the headquarters of the Gates Foundation is located. I'm a senior program officer in the emergency response team. We are a very small team in a very big organization. I think the Gates Foundation is better known perhaps for the global health work that we do, like polio eradication, malaria eradication. Those are our maybe better known efforts. But of course, we also are funding many projects in the global development space and agriculture and digital public infrastructure. And we have a division on gender equality. And our team, the emergency response team, we fund both catalytic funding for emergency relief. So when there's a disaster, we provide immediate funding so that relief can get started. And we fund longer term projects that are preparedness focused. We believe that the gap between the available resources for relief, and what the humanitarian needs are, just that gap continues to widen. So it's much better to invest in preparedness so that the countries, the cities, the communities are better prepared to withstand the shock, respond effectively, and then recover, hopefully faster and better. So very happy to share some of the work that we do and from our experience, and also eager to discuss the topic of today's webinar. Thank you.
Thank you so much, Bila, for that introduction. If you are just joining us, so today we are looking at, the role of gender data in disaster, and we have three amazing panelists who are experts in founding, in open mapping, in open data, and also leading disaster emergency in Mozambique, and they would be sharing their expert knowledge on why it matters. So I'm going to start by, asking this really interesting question. We've seen from, evidence, we hear Director Christina was talking about the disaster that happened in Mozambique between February and, January and February this year, how, a lot of households were affected. And we've also seen how, we saw that women and children are the majority affected. So from where you all sit as a community mapping, as a national coordinator coordinating disaster emergency response, and as a global funder, when does that gap become most visible in practice? And also in those moments, does it feel more like a lack of data, or do you think, the way the systems are designed to prioritize and use the data that we have is the problem? So I think maybe Veronica, if you can just share what you think about this from your own experience as a community mapping mapper. Yeah.
Yeah, thank you. This is a really important question. From the community mapping perspective, the gender gap becomes more visible when we compare what happened or what appears on the map with what women actually experienced during a disaster. Because maps usually show infrastructure such as road, buildings, administrative boundaries, but they rarely capture how women navigate those spaces during a crisis. So women often know for example, which water points stop working during floods, which roads become unsafe, or which places become overcrowded when families move to accommodation centers. So the knowledge is there. The problem is that our data systems are not designed to capture that knowledge in a consistent way. So in mapping processes, if the mapping processes only focus on infrastructure, women realities never become part of the data set. So the real issues is not only the lack of data, it's also how our data systems are designed and what they prioritize. And that's why women's participation in mapping is so important. It helps to ensure that the knowledge becomes part of the data that inform preparedness and response. Yeah, thank you. Over to you.
Thank you, Veronica. I think I'll come back to some of the answers you've given in the follow-up question that I'm going to be asking you. So now I'm going to pass it to Director Christiana. From your role as a national coordinator leading disaster emergency, what would your take be around this question? Like, when does that gap become most visible in your own experience? And, does it feel like a lack of data, or is it the way the system have been designed to sort of prioritize and use the data we already have?
Muito obrigada. Bem, se calhar, quero aqui reconhecer que realmente a questão da desagregação de dados no nosso sistema ainda é um desafio. É um exercício que nós temos estado a fazer sempre, mas ainda não conseguimos atingir o nível em que gostaríamos para prover esta informação desagregada a todos os intervenientes e a todos a quem interessar a informação com o devido detalhe, informação que permita que cada um possa fazer a sua planificação e melhor decidir sobre como intervir. Mas é um exercício que nós temos estado a fazer, reconhecemos que temos esta lacuna e grande e temos estado a fazer esse exercício. Ocorre que os dados no nosso sistema, eles são recolhidos a partir da base, a partir dos comitês locais de gestão do risco de desastres, através das lideranças locais, ao nível da base, nas comunidades, e esta informação deve ser validada ao nível do distrito e depois tem que ser também passar para o nível de província e só depois é que chega ao nível central para a nossa sistematização central e validação final. Mas ao nível da base nós temos muito poucas pessoas que na altura de emergência elas estão envolvidas em muitas coisas. É verdade que as nossas fichas, os nossos mecanismos para captar informação da base já prevê esta desagregação, mas as pessoas priorizam naquele momento de pico informação que lhes permita resposta rápida, porque não estão com muito tempo para fazer esta desagregação e ir atrás para ver as mulheres, a idade, quer dizer, a faixa etária, organizar tudo e até com a questão de pessoas com deficiência. Então, e depois disso, no momento mais calmo, já não há muito tempo, as pessoas já estão dispersas, é muito difícil coletar esta informação. Mas temos estado a fazer um esforço, as nossas bases de dados já reúnem alguma informação desagregada, mesmo reconhecendo que ela ainda não é suficiente para que possa prover a todos aqueles que interessam a informação desagregada. Obrigada.
Yeah, thank you so much, Director Christina, for your contribution. Pilar, what's your own take on this from a funding perspective?
Thank you. Very interesting answers and very valuable information. From a funder's perspective, first of all, I want to say I think we have a responsibility to use our influencing power to, I want to use a strong word maybe, to demand that data is gender disaggregated, that the right methodologies are being used, that the design of the different systems that are being used to collect data are have a gender lens to them, because we cannot, if we don't do our part, we're contributing to keeping, or even widening that gap of gender disaggregated data. I think that if we don't do our part, that invisibility of women and the women and girls' needs continues to remain. Like Veronica was saying, if we don't have, or even Directora was saying, if we don't have appropriate data, then we're not addressing the right needs in the communities. So there's a mix of gaps in design and methodology. There's data bias. Not, if you're not collecting information of, I don't know, child care centers or community centers where women are most active, then you're missing on on very critical information that can be used to design a better response. So, for example, what Directora Ana Cristina was saying, in times of peace or in quiet times, that's when we would hope that governments, local governments, communities are paying attention to that data. They are correcting any gaps that they've identified, because when it's emergency time, it's true that everything is happening so quickly that you don't have time to stop and do that. It's something that we need to be trained on. That's why you have the rapid assessments that have a gender lens. So I think as funders, we definitely need to demand that more. To the Gates Foundation, one of our values is rigor, and that means that we use data to make investment decisions, to decide what we support and how we support it. So that means that we are looking at data. We need to understand, for example, the impact of different interventions. And that's why we ask our grantees to collect data. So not only demanding it, but also supporting the organizations that we fund, so that they are paying attention to the data that they're collecting and correcting what needs to be corrected. Thank you.
Yeah, I think that's a very important feedback. So from all of what we've heard from the panelists, we see like it's both a data problem and a system problem. So from Veronica's experience, for example, the mapping infrastructures are prioritized during mapping. They don't really collect information that are related to women. And then Director Christina was also talking about the fact that, data comes from different levels. It comes from like the grassroots and then goes up like some hierarchy of data collection. And then during disaster, there's really no time to disaggregate the data. And Pilar is also trying to then, say that, maybe this is something we need to start thinking of. They, as people who are funding, projects, to start maybe demanding for this type of data from the people who are being funded. So I think these are really interesting takes. So Veronica, you mentioned, while you were answering your questions, you said, infrastructures are being prioritized, and those infrastructures are really not like the infrastructures that probably women would be useful for women, and just to frame it that way. So from your own experience, how do you then think involving women directly in mapping change the kind of data that gets produced? And maybe you can also share if you've seen a moment where having more women in a mapping project actually sort of created like a tangible difference from the data product that was generated for that.
Yeah, thank you so much for your question. I believe that when women participate directly in mapping, the type of information that gets captured changes in a very practical way. As I mentioned before, traditional maps tend to focus on physical infrastructure, and those things are important, of course, but they don't always reflect the places that matter the most in women's daily lives. So when women are involved in mapping, they often highlight locations that are essential for their daily routines. For example, they often prioritize mapping water points, healthy facilities, markets, school, childcare spaces, as Pilar mentioned. And they also focus on how accessible and safe those places actually are, not just where they are located. So, for example, a road may appear on the map, but women may explain that during flooding, it becomes difficult or unsafe to use that road, especially when they are moving with children or carrying water during their daily activities. So when women participate in mapping, the map begins to reflect how those spaces actually function for women and their families, not just where the infrastructure exists. So it was visible in this year during the floods in January, where in some accommodation center where women highlighted that they were facing water access issues, sanitation facilities were not functioning properly, where the place was overcrowding and it was creating a serious challenges for the families. So, and they also raised concerns related to privacy, safety at night, access to health services for pregnant women and mother with children. And these are the realities that women deal with every day during a crisis, but they are rarely captured in the data sets for data set used for planning. And women also helps identify which roads are really used during flooding and where community move to reach safer ground. Sometimes it differ where the technical team point as a safe place. So when women participate in mapping, the map start capture not only the infrastructure, but whether those places actually work for women during an emergency. And I believe that makes the data more useful for preparedness and decision making.
Yeah, thank you so much for like that safety angle you brought in. I think, yeah, we see now why we, say like this type of data is really useful. It's not just about even when disaster, happens, we need to think of how it affects women in terms of like safety, giving information about what is accessible, and what is not accessible, how safe it is for them. Yeah, so really thank you for that safety angle. I think it's really interesting. So I'm going to then pass it now to Dr. Christiana. Veronica comes from a community mapping community, and we know how important it is to sort of also consider like the local knowledge, because when we talk about data collection as well, we need to sort of also think of the local knowledge that the people from the community also bring into that data collection part. So for Director Christina, what makes externally generated data, like the community mapping data, credible and really actionable within national systems like Senua?
Muito obrigada. Bem, nós não temos dúvidas nenhumas que para que nós possamos ter esta informação, desagregação de dados e em tempo útil, nós temos que ter pessoas capazes de fazer isso e com a devida flexibilidade e profissionalismo a nível de base. Não que as pessoas na base não sejam profissionais, mas o que eu dizia antes é que na base, nos distritos, são as mesmas pessoas que fazem tudo numa situação de emergência. Então, na emergência mesmo, a prioridade para eles é saber quantas pessoas ficaram afetadas, quantas pessoas ficaram sem casa, quantas pessoas precisam de casa, sem olhar para estes detalhes todos. Mas um processo de preparação de pessoas a nível de base, se calhar precisamos de envolver mais, treinar mais pessoas, não contar só com os comitês locais ou as autoridades locais, lá ao nível do distrito, porque, como eu dizia, são poucos. Se calhar precisamos de treinar mais pessoas, termos numeradores que possam, é um dos desafios que temos estado a pensar vigorosamente nos últimos tempos, em criar numeradores ao nível do distrito para reforçar esta capacidade, treiná-los para poderem fazer este levantamento logo que ocorre alguma situação de desastres, as pessoas naquela altura que estão a fazer o levantamento de dados, de avaliação rápida, possamos ter também esta informação devidamente desagregada para prover esta informação a todos os interessados e todos os utilizadores desta informação. Então, é importante, sim, termos esta informação, como eu dizia, reconhecemos esta necessidade e nós já nos desafiamos a isto para prepararmos melhor a base para que as pessoas possam nos facultar esta informação e nós possamos, em tempo útil, ter estes registros para que ela não chegue de forma extemporânea, porque depois daquele momento da avaliação rápida também a informação já não é muito útil. Dizia eu que as pessoas já estão dispersas, já não estão nos centros de acomodação, já voltaram à sua vida normal, mesmo aquelas pessoas que não estiveram nos centros de acomodação e já tentaram refazer as suas vidas. Então, pode ser que esta informação chegue, de forma extemporânea. Então, precisamos de trabalhar com a base, treinar o pessoal na base, especializar profissionalizar o pessoal na base para que eles possam nos prover esta informação em tempo útil nas nossas plataformas e nós possamos processar e trabalhar esta informação para disponibilizar para todos os utilizadores. Obrigada.
Yeah, really, really thank you for sharing that insightful thought. So we hear you say, yeah, like you recognize the need for community data, but then we need to really train more people on how to start collecting, those data. So that means we need to include more women in the training on the community level so that they can be trained to collect the data, not just during the disaster or after disaster, but before the disaster, because at the point where disaster is happening, the communities are now focused on other things. And at that point, it's hard to now start thinking of disaggregating the data. So we need to start thinking of how to collect that data before the disaster, happens. And, we need to strengthen our communities to be able to do that. So thank you so much once again for, bringing that national perspective into the conversation. So Pilar, I know like you touched on this a bit when you were sharing, your experience about how we need to start thinking of as funders, as how we need to start thinking of sort of demanding this type of data from even people that are being funded. So maybe I just want you to maybe go a bit more deeper into it to talk about how the funding structures actually influence what gets measured and valued in emergency preparedness and response, and what do you see globally from your experience?
Thank you. Yes. So the Gates Foundation in general, we have been for the past, I would say, 10, 15 years, have been very intentional on ensuring that the projects that we fund are collecting right data and applying a gender lens to their work. So to that effect, we work with our grantees, with the organizations that we support, so that they really think about the work that they're doing and think about that applying that gender lens. So we have a series of criteria and questions that we walk them through because we want to make sure that as much as possible, projects are gender intentional, but even more than intentional, we want them to be gender transformative. And what does that mean? For example, in the case of emergency and preparedness response, preparedness and response and emergencies is what the two panelists were talking about. For example, representation. For example, make not just counting, how many women or women and girls, and not just gender disaggregated data in that way, but in terms of services, in terms of needs, so that resources are being allocated to addressing the most urgent needs for the communities, and those that are specifically for women and girls or for people with specific disabilities. It's about taking considerations. For example, if you have the appropriate data, you can have a shelter with safe spaces for women and girls, for example, or you can have hygiene kits that address the specific needs of women and girls. So that's why it's so important to, yes, definitely train community, involve more women and girls in the data collecting systems. Representation matters. It is important. It is important to have the data collectors being, including women and girls. It's important to leverage the leadership, the local leadership that women have to access certain spaces or certain groups where you can get information or where you can validate certain information. I think that there are some societal barriers that sometimes prevent, there are social norms that need to be addressed. So it is a bigger issue. There are safety concerns, but in the case of funders, we can work with our grantees to brainstorm solutions to those barriers that they're seeing so that we can find the right approaches to solving those issues or to addressing those barriers that are preventing the right data from being collected. I think that in terms of what we see globally, we do, there is that just having this webinar is an example of the interest, and not only the interest, but what organizations are doing to address this issue of having a gender gap in the data that they're collecting, and specifically in mapping, which is the work that is being done in Mozambique under the support of the project that HUT is implementing. So that's what I was saying. As funders, we do have that responsibility. Every funder wants to understand the impact of work through data. Data and evidence is important. It speaks well about the work that is being done in the community and how communities' lives are changing for the better. So we do have that responsibility to use that influencing power to, like I was saying earlier, to demand that data is gender sensitive, gender disaggregated, and that the right approaches are being used to include women and girls in the right ways, so that the projects can be even more successful for the communities. I think that what the two speakers have shared before me is well aligned with what we prioritize as funders, and I'm glad to hear that we're so aligned. Thank you.
Yeah, thank you so much for sharing that experience. Maybe just want to ask one follow-up question. So where do you see like the biggest opportunity to strengthen the gender data infrastructure? Because you really touched on a lot of very interesting points. You mentioned the fact that it's not just about counting women, we need to sort of start thinking of the services as well. So maybe like, what would you say that the biggest opportunity would be to sort of strengthen this, the data infrastructure as related to the gender aspect?
One of the things that I always think about, maybe 15 years ago, talking about gender data, gender disaggregated data, or gender sensitive or gender lens, those were nice things to do. And we have moved from that, what I've seen, to this is a critical thing to do. This is something that must be done, must be addressed. So using that intentionality, we need to work. For example, Director Ana Cristina was talking about, and Veronica, including more women and girls, training more women and girls. And that has to do with leveraging the leadership and the agency that women and girls have. And that's why, I also said there are societal norms that need to be addressed, and those are, those are big issues, those are big things, but I think this is the moment. We have moved the needle quite a bit. So it's how do you address representation? How do you use, I don't know, proof of concepts in some communities so that that practice can be scaled in other communities? We often talk about that disasters impact women and girls differently, and they do. And that's one aspect of the data, right? Looking at how women and girls are impacted in terms of services that they may need, specific, like I was saying, hygiene kit that may be different because of the specific needs. But ideally, I would like us to also move more into the leadership role that women play in their communities, in local governments, or in government institutions. Like we have a great example here with both Veronica and Directora Ana Cristina, women in leadership roles. So I think that needs to be leveraged and much more incorporated into the work that all organizations do in this area. I think that that's an opportunity that we need that can really strengthen data, not only the data collection, but the data analysis. If you're including women and girls, they're analyzing it from a different perspective. So the representation is not only in the way that data is being collected and whether we are collecting the information that they're giving us, but when it comes to analyzing that data, it has to be an inclusive approach. Women and girls need to be part of those teams because there are different perspectives, and it will be a more holistic approach to addressing the needs of the community. I hope I've answered your question.
Yeah, I mean, you made really interesting points, and I really like how all of the points made by all of the panelists sort of linked. Veronica started by saying that because we need more women so that women have experiences that are not always captured in data collection, so we need more women to be able to do this. And then Director Christina talked about they understand that there's this gap, so we need to train more women. So if we train more women, then we can have more women collecting this data, then the data is representative of their needs. And then you're saying we need to also think deeper. It's not just about the data collection. We can also think about the data analysis part. It can also be representative. And we should also sort of exploit the fact that we have women in leadership, and they can use all of these different resources to ensure that we can solve these societal barriers where that makes this conversation or this gender disaggregated data an issue at this point. So yeah, I think it's really strong points that all of the panelists have shared. So I would like to now open the questions to the audiences. So if you have any question, you can just share them. So we'll just take a few questions for the panelists. So you can just drop them in the chat. If you have any questions as regards this gender data gap, would like to hear from you. Maybe while we wait for questions from the audience, are there any other points that the panelists would like to share, just to add more to the conversation that we're having? Okay. Okay, I think we have one question from Fabrizio. Okay, if I read the question well, so it would be which area could be the best practices to involve women in data collection in disaster settings and make sure that data counts in decision making. Or if any of the panelists would like to take the question, you can just unmute and then.
Just to clarify, so my question was more around which are or could be the best practices to involve women in data collection in these settings and make sure that that data counts in decision making. Now, that said, the area is also significant, like which areas are more relevant. I was also like intrigued to expand on this example that was provided about roads. I think it's a classic example on where we have the data, but no one is actually considering the gender dimension around it, or we have the data about shelters, but not really about the services provided to women in those shelters. So yeah, like I'm curious about like, you know, things we are seeing during the implementation of the project, but beyond that, like which are the best practice? How do we make sure that women count in this data collection and decision-making processes in these settings? Yes.
Director Christina, I think maybe if you want to take the question, you can mute your mic and then go ahead.
Muito obrigada. Bem, se calhar indo a esta pergunta sobre quais são as áreas em que as mulheres podem melhor dar a sua contribuição na recolha de dados, se calhar poderíamos olhar, falar das áreas sociais, basicamente. Eu penso que as mulheres são muito mais sensíveis à componente social, né? Olhando para a questão das crianças, a questão das vulnerabilidades, a questão de olhar para as comunidades. Queria aqui realmente reforçar esta questão da necessidade de recolha de dados certa antes, porque fazendo esta recolha, identificando, envolvendo as mulheres neste processo antes, no processo de prontidão, de preparação, fazendo esta recolha, sistematização, mapeamento desta informação, fica muito mais fácil na altura de ocorrência, já temos as bases de dados devidamente atualizadas, já sabemos que na região X, antes nós tínhamos tantas crianças, tantas meninas, tantas mulheres idosas, tantas mães, chefes de família, tantas mulheres grávidas. Com este período, a esta altura que aconteceu o evento, é fácil estimar e rapidamente termos a informação e provermos esta informação, em vez de procurarmos fazer esta coleta na altura da emergência, que a coisa já, o que acontece muitas vezes já não temos tempo para fazer este processo. Então, eu queria concordar mesmo que antes é sempre melhor e envolver as mulheres para estas áreas sociais que elas são mais sensíveis neste processo. A outra coisa que eu queria acrescentar é temos que também passar para outra fase. Treinar as mulheres, sim, as pessoas na base como numeradoras, sim, mas provê-las também de meios para elas poderem fazer este levantamento e lançamento de informação em tempo útil. Então, é possível treinar as pessoas com ferramentas, com instrumentos, equipamentos fáceis de manusear ao nível da base, para que elas possam rapidamente fazer o lançamento da informação e aos diferentes níveis que têm que validar, terem esta informação em tempo útil e fazer a devida validação. Obrigada.
Yeah, I mean, we're saying that again, like the data collection part, it's really important that we do that before the disaster happens. I think like that's a message that Director Christina is trying to pass across to us, that data is important, but we should not start thinking about this data when disaster happens. The National Emergency Center would really need this data before the disaster happens. So I think that's like saying that again. So thank you so much, Director Christina, again for saying that again. Veronica, you have contribution as well to make on that, so you can go ahead.
Yes, I just wanted to add on what Director Christina said. I believe that from our experience in Mozambique, one of the most effective approach to make sure that involve women count in decision making is participatory mapping approach, because it allows women to contribute with their knowledge, the knowledge about their community in a very practical way. Because as we mentioned, women often know where the key servers are located and how these services benefit them during the disaster. So it's important to create a safe and accessible space for women and girls to participate more in mapping. So organizing small sessions with women groups, working with the local association in the communities, and also link to the national disaster management authorities. They can feed this data into their system for actually planning and response. Thank you.
Yeah, so we have a couple more questions to go. So I think this question is more directed to Pilar, but if anyone on the panelists would like to take it, then that's fine. So the question says, how does the funding influence women visibility in data generation or disaster data management?
I think and I'm gonna just jump to the questions because of time. I think it has to do with how we're setting up the organizations that we support for success when it comes to data collecting. So, for example, what indicators are they using? Are those is there a gender lens being applied to that to those indicators? We need to ask the hard questions. As funders, the funding mechanisms that we have and the funding influence that we can, push. For example, something that we have done in our team is that we ask, do you have someone in charge of M&E? Of measurement and learning and evaluation. For specific, projects, we have actually allocated resources. If there isn't someone in charge of data collection or measuring impact, then we ask that part of the budget is dedicated to maybe hiring someone who's in charge of that, because organizations sometimes deprioritize. I understand there's so many competing priorities, but if you understand the value of having data, the right data, then you will prioritize having someone in your team. So I think we can use that influence and to making sure that in this case, women and girls' needs are visible with the data that is being generated, and especially involving women and girls in, like I said earlier, collecting and analyzing that data. Thank you.
In the interest of time, we have one more question. I think probably Veronica, maybe it might be interesting if you answer this, because I think you have like the community mapping sort of experience. So the question goes like, if anything comes to mind, I would love to hear about any successful stories when gender-focused data improved the outcomes or process or the process in disaster response, how and why. Maybe Director Christina as well, maybe you have any experience where there's a story where like having actually this data sort of maybe improve the outcome of any disaster response. If there's any experience that you would love to share, and I think it would be interesting for us to hear that.
And maybe I can jump in quickly, if that's okay.
Yeah, sure, that's fine.
Not being an implementer, but what I've seen in certain projects, for example, like shelters, for example, that's something where you see that that decision making based on the right data is impactful because you create safe spaces for women and girls, or something as simple, but sometimes we're not taking the right considerations because we don't have the right information or data, is where are the restrooms located? Is there enough lighting to create a safe path, or are there the right so for example, if you're thinking of food or non-food items, do we have what women and girls need? So I think that we see a lot, like in refugee camps or in shelters. I think that's something where I can see it as an example. And the other one that I just wanted to quickly point out is all of this, when the right data is collected, analyzed, put into practice, and then it can turn into, policies, or decision making for the local governments. I think that is a win, and that makes this sustainable in the future. So would advocate for that. Thank you.
Director Christina, over to you.
Muito obrigada. Bem, sobre a questão de sucesso, um exemplo de sucesso baseado nos dados recolhidos com a priorização, nós podemos aqui partilhar que exatamente nos centros de acomodação, o que nós, os dados desagregados, quando nós temos informação sobre mulheres, crianças, meninas, é possível disponibilizar os recursos, facilitar os recursos de assistência, tendo em conta esta questão. Por exemplo, nos centros de acomodação, muitas vezes nós temos, quer dizer, temos que separar homens e mulheres, usamos salas de aula, por exemplo, para acomodar as pessoas, e não podemos misturar homens e mulheres. E os dados desagregados permitem-nos priorizar maior número de salas, por exemplo, porque muitas vezes as mulheres são a maioria, com as crianças. Então, nós conseguimos organizar os centros de acomodação, preparando o maior número de salas para as senhoras, para as mulheres, em relação aos homens. E outra coisa tem a ver com aquela questão da distribuição dos kits de dignidade. Os kits de dignidade são destinados às mulheres, às meninas, adolescentes. Então, com base nos dados desagregados, permite-nos ter informação sobre quantas pessoas, quantos kits de dignidade nós temos que priorizar. Em relação às mulheres grávidas, idem para a priorização da questão das redes mosquiteiras, etc. Com base na informação desagregada, esta informação permite-nos estimar quantas redes mosquiteiras nós temos que enviar para uma determinada região, um determinado centro de acomodação, para priorizar as mulheres grávidas que se encontram naqueles centros de acomodação. Então, é um pouco da experiência com base nos dados, apesar de não serem ainda robustos, como eu dizia, e nos permitem essa informação planificar melhor a resposta. Obrigada.
Yeah, I think we're almost running out of time. Yeah, so thank you everyone for joining the session today. I think I would say like the most important thing that I've gathered, and I hope like every other person on the call as well has been able to gather, that is that this gender disaggregated data is really helpful, and it's really important that we sort of start thinking around how do we start collecting this data, not during the disaster, but before the disaster, as well as not just the data collection, but the data processing as well, the data analysis, because women bring experiences that are very important that we can always leverage when we talk about responding to disaster. And we need to invest in training more women so that they can also participate in, this mapping, community mapping, participatory mapping, like Veronica mentioned, where community comes together to map. So we need to sort of start thinking of how do we train more women to take part in, this ecosystem, and how do we ensure that we can collect, data that can support, the national, agencies to be able to also respond, and also have the data that they need to sort of really prioritize, especially when we talk about disaster response. So really, thank you everyone for joining, and thank you again, Veronica. Thank you, Pilar. Thank you, Director Christina, for bringing your experience into this conversation. We hope that everyone who has been able to join the session has taken so much, knowledge away from this, and we hope like these conversations you can also extend in your own small spaces to ensure that we keep talking about women, not just celebrating the women, but also trying to think of the societal barrier and how we can ensure like we can put systems in place to sort of improve the safety of women, especially as regards to humanitarian and disaster response. So thank you so much once again for joining. We really appreciate your time for this session. I think that will be all from our hands.